Acid reflux is really the acid from the stomach that goes up into the esophagus. It's often referred to as heartburn, regurgitation, that type of stuff. Reflux is extraordinarily common. About 25 to 30% of people complain of it, and a lot of people self-medicate because all of these medications are now over the counter. Stopping reflux is important because reflux can cause progression of disease in the esophagus. And you can even get esophageal cancer because of very, very aggressive reflux. So the goal is to minimize the amount of acid going up in the esophagus. The medications help, but the medications are now found out to have some side effects and maybe even put people at a higher risk of developing other disease. So the surgery that we do is a way to minimize the reflux, help the patient. The Lynx, this new product, is really the newest innovation that is allowing people to get the benefit of surgery. It's a magnet that actually acts very similar to those candy necklaces that we had as a kid. It allows the esophagus to stretch, and then when the food bolus or whatever they're swallowing that goes through, then it'll clamp right back down, minimizing the acid from going back up. This is the Lynx, and you can see that it stretches, and then once the food is passed, it comes back down. And it's very easy to put into around the esophagus, right at the base of the stomach, and therefore that acid just won't go up. It is there for life, and that's the goal. You do want to follow up with your doctor just to make sure that they're not having any complications. The complication rate of this Lynx is extraordinarily low, but really the follow-up with us is very minimal. Most of the time it's a 5 to 10 minute visit, and the cool thing for us as providers is that they really come back and say, this has changed my life. I no longer have that heartburn. I don't need that medicine anymore. I feel good. I could swallow. It's just that amazing of a product.